Hey, I know I look like a hot mess, but it's because I had a heart cath a few days ago. And I want to share my experience while it's still fresh on my mind for those of you who are terrified and going through it for the first time. If I can find the videos that I've watched from other people, I'll link them down below as well, so you can also view those. The first thing you should know is that I had the radial or transradial cath, which means they went in through my wrist. You need to look at videos by people who've had it done through their groin because it's a slightly different situation and definitely different post-op recovery. So be sure to check those out as well. My situation is that I have a bad aortic valve. It's bicuspid instead of tricuspid, also called a leaky valve. And what happened was that on my echo recently, the echo tech detected pulmonary hypertension. That's a really scary diagnosis in any situation. And in this case, it would mean that it was time to replace my aortic valve. So as a matter of procedure, they go in and double check and make sure the echo is correct. And then they also check to see if there are any blockages or anything else they need to correct while they're in there. As it turns out, thank God, the echo tech made an error and I did not have pulmonary hypertension. So no surgery for right now. My biggest fear was being awake during the entire thing. I was also afraid that I would be so traumatized I would not be able to do it again, because in researching all this, I figured out that usually in my particular situation, or in a lot of people's situations who have heart or valve issues, you're going to end up having it done more than once in your lifetime. So you need to be able to get through this with as little terror as possible. I had a lot of terror, but it was a mixed bag. I was afraid of the procedure. I was afraid of having open heart surgery, and I was afraid most of all that the doctor would come back and say, yes, you have pulmonary hypertension, but it's independent of your valve disease and you have 2 years to live. That was my biggest fear. So it was a lot to go through for a week and a half. I had my procedure done at WakeMed in Raleigh, and from the person who first greeted us at the registration desk, the receptionist, to the person who wheeled me out, it was a great experience. So I'll tell you how it was for me. It will be different depending on where you are, but I think it'll generally be the same. So we go into the hospital. My check-in time was 6 a.m. And let me add this. Beforehand, if you're like me and constantly taking headache powders in the fall or ibuprofen for any reason, be sure and check with your doctor, because they're probably going to tell you not to do that. And also cut down on your drinking. They will give you an aspirin and blood thinners, so don't add to that. Okay, so we go into the receptionist booth in the heart center at WakeMed. This lady gives us a number or some slip of paper. I couldn't pay attention at that point. I was so scared. My husband was with me. And we go to a lady in a little office, and she checks to make sure I've already paid the hospital bill, because of course we have to get that taken care of. She processed our papers, and then we went outside to wait on the nurse. And by the way, speaking of finances, the hospital called me beforehand. I paid my bill for the hospital, and they told me that I would get a separate bill for the anesthesiologist and the doctor. So I'm still waiting on those things. So the nurse comes to get us, or I think it was actually the nurse's aide. And one of my fears was having a urinary catheter. Turns out I didn't get that. Maybe you do sometimes, but I did not. They said you're not in there long enough. So even if they go in through the groin and you're on your back, you're still not getting a catheter. You're peeing on your own. I'm not sure how that works when you have it through the groin, but that's what happened. So she takes us up to the pre-op room, and a lot of things happen all at once. One was that they put an IV in my left arm, and that was for the regular meds. They put an IV in my right arm, and that was for them to go in through the right heart. So in my case, they were doing a left and right heart cath. So the IV in the right arm was for some regular meds and also for the doctor to access my right heart. Now, not to scare you, I'm not really afraid of needles, but this was a little uncomfortable, especially under the circumstances. She couldn't find the vein she needed. There was a very specific way they have to go in. So she got an ultrasound machine to find it and put the needle in, and it took her a while to get it into the proper place. It wasn't extremely painful. It was a little uncomfortable at times. Normally I could handle that better. I was just already so terrified. They also shaved my groin in case they need to do go in through your groin instead of going through your wrist. So they're not going to stop what they're doing and then prep you. They're going to have you already prepped and ready to go if they can't go in through your wrist. So what I gather from that now is that it is standard procedure to go through your wrist unless they can't for some reason. They also gave me an aspirin. As soon as I got in the pre-op room, and by the way, the pre-op room was very small. You have a curtain. You have to go outside of the room to go to the restroom. So if you have people with you, you will probably only have room for one person to go up there with you. They also put all my clothes in a bag, and they actually just kept that on the bed. So it was there waiting for me later. My husband didn't even have to take that with him. My husband did take some other things like my shoes, but they just left the bag there on the bed. The bed was plenty comfortable. As soon as I got in the pre-op room, I asked for Valium. They didn't want to give it to me until they saw my blood pressure. Then they gave it to me. I didn't think it did that much for me, but my blood pressure came down, so apparently it did. My doctor was supposed to be done with the meeting at 8, but it was closer to 9 when they came and got me. Because I didn't have a urinary catheter, I went to the bathroom 3 times. Not because I thought I was going to have an accident during the procedure, because honestly I didn't care, but because I knew when I got back to my room from previous surgery experiences, I had one biopsy where they had to put me to sleep. And I woke up and I was so relaxed and wanted to stay asleep, but I couldn't because I had to go to the bathroom. So I knew that it was important to empty my bladder before going, because when I was done, I would want to rest and not have to rush to the bathroom. So they did all this stuff. They did the IV in the left arm, the IV in the right arm, shaving me, giving me an aspirin, eventually giving me the Valium, asking a ton of questions. And the PA came in basically to reassure me. And then eventually the doctor came in and talked to me. And then finally, some of the anesthesiologist, I think it was, and a nurse came in to get me. I lost track of who was who, and I didn't know what they were doing. I was at a point where I was just crying, and I didn't care. I was so terrified. And I don't want you to be terrified, because it's really hard to come down from that. I am still decompressing. I'm going to tell you, it wasn't a fun experience, but it wasn't horrible. It wasn't like Nazis were experimenting on me, okay? You can get through this. So my worst fear was being awake through the whole procedure. I had previously had a transesophageal echo when I was pregnant. I don't remember a thing from it. That's what I wanted to happen. That did not happen. I was completely wide awake. I was sedated some, enough to keep me from moving, but I was wide awake. And we go into this operating room. I have read that these rooms are usually small. It was not. It was a perfectly normal size operating room. They moved me from my hospital bed onto the table. The table it wasn't a mattress, it was more like a foam kind of mattress, perfectly comfortable. They put both my arms in these little side stirrup things, which is much more comfortable than trying to keep them by your side. And I have seen in videos that they would put a sheet between you and you see me putting my hand up so that my fingers and arm doesn't get swollen. I have seen in previous videos that they would put a sheet up so that you couldn't see what's going on. They didn't do that, but I really couldn't see what was going on anyway. I really, most of the time, couldn't see the screens. I didn't think I'd want to see them. But when they actually started going in through the right heart, let me back up. It probably took 10 to 15 minutes of prep work in the room, and one thing that really made me feel better was hearing how well everyone worked together as a team. Not only were they doing their own jobs, they were anticipating other people's needs and saying, do you need this? Yes, please. Someone else would say, do you need this? Yes, please. Even before the doctor came in. So it did give me some comfort to see that people knew what was going on. Then the doctor comes in, they start, and the only way I knew he was working already on the right heart was because I could hear the sound of the tube going in through the sheath. And I knew that from watching all these videos. Otherwise, I wouldn't have known. I couldn't feel anything. So, and that's what the PA had told me. You don't have nerves there, so you won't feel it. I couldn't feel it. When he started to do my left heart going through the artery, that I could feel only because even though he gave me, and this is interesting, he gave me a shot to numb the injection site, and I barely felt that at all. So he did a really good job with that. When I changed the bandage the next morning, I saw he'd actually given me 5 shots. When he started to go in, I said, is that supposed to sting? And it's not because it was that big of a pain, but I was just concerned it wasn't supposed to and it would get worse, and I didn't want to be jumping around when he was near my heart. And he actually said, can you feel that? And then he gave me, I guess, another shot or two. Again, I didn't really feel him working in that area. What I did feel that freaked me out, and I'm saying this to you not to freak you out, but just so you're aware, is that I could feel the wetness on my wrist, and I knew that was my blood from the incision or puncture or whatever they actually do. So that was freaky. It wasn't painful. It was just freaky because I knew what it was. When he got to my heart, it made my heart jump. And I said, is that you? He said, yes. And then it happened again, but it didn't happen just once. It happened several times. And I asked him if I could cough, because I know that if you cough, that helps reset your heart. And he said, just a little. I think he was getting tired of me talking. So I coughed just a little, and that was it. And then we were almost done at that point. I think we were in there about 45 minutes actually doing the procedure. I think 10 or 15 minutes was prep work. So I come out, they take me back to my room, bring my husband up there. The nurse said, treat your wrist like it's broken for the next 24 hours. And then they give you all the discharge instructions, which include things like don't wash dishes, take a bath, sit in a jacuzzi. To avoid sepsis, you don't want any chance of bacteria getting in the wound, so you can't submerge your wrist for 24 hours. For a week. For a week, you cannot submerge your wrist or get it in any water that might have bacteria in it. So for 24 hours, my discharge instructions said not to bend or twist, but my wrist was really tender, and it's only today, going on after 48 hours, that I'm using it more and more. And I still find that if I do too much, it starts to get sore. Because I had it done through my wrist, I was able to sit up and eat and drink. Of course, I was really thirsty because I hadn't had anything to drink. Well, not much other than a few sips of water to take medicine. And he brought me lunch. They had a compression wrist band on my wrist. And an hour after you come in, he'll come in and let out some air to make it looser. And if it doesn't bleed, then the nurse said he would come back in another hour and do it some more, and then every 30 minutes after that till they could take it off. And basically that's when you can go home. Well, as soon as he let it out a little bit, it started to bleed, so he had to leave it. And the next hour he came back in, same thing, started to bleed again. So then he had to do manual compression for 8 minutes. And then the next hour he comes back, it doesn't bleed, so he can start letting it out. I was able to get up and go to the bathroom, just had to be careful, pretend my wrist was broken. And I have been doing a lot of this, holding my wrist up to avoid swelling. I don't have a big bruise so far, but I've seen some people who've had really bad bruises. And I have to say that overall, the whole experience is not something I care to repeat. I do not. But I know I'll probably have to, and I think that I can do it again. I don't think I'll spend as much time being absolutely terrified like I was before. When I was pregnant, I was terrified of getting the spinal. When I had my second child, I was even more terrified. And that wasn't painful, and that was a much shorter process. But, it's all scary, and it's very serious. It's not something you want to do unless you have to, but it's one of those things that had to be done. Because if I really did have pulmonary hypertension, and it was time to replace my aortic valve, then it was that or die. So those were my options. So no one can take away your fear. They just can't. But you can get through it. It's not the most awful thing in the world, actually. I'm not saying that it's fun. I'm not saying that you'll enjoy it. But yeah, you can do it. I was fully awake. I have no amnesia. I remember everything. It was okay, relatively speaking. Not okay like it's an okay day with the weather. It's okay with a bad medical procedure you don't want to have. So I'm not saying you won't be scared if this is your first time. I'm just saying you'll get through it, and you'll see it'll be okay. And it'll be fine. It's generally not a painful procedure. It's just scary. And some people have them done multiple times. So try to put your mind at ease a little bit, because if it's something you need to have done, you really need to get it done. And also find some Facebook groups that support your type of particular problem. That will help a lot as well. So Good luck. Try not to be too terrified. It's not as awful as you think it's going to be. My biggest piece of advice is put one foot in front of the other. Go from one step to the next. Bye.